Hormone deficiency is more common than we realize, and it can start at earlier ages than expected. Even in your 30s, people start having decrease in hormone production. Testosterone declines in our 30s, estrogen and progesterone decline in our 40s, and this is many times a cause for fatigue, weight gain, anxiety, mood swings, difficulty sleeping, problems with having interaction and feeling of well-being. So patients that have an imbalance in their hormone would benefit from hormone replacement. There are many different ways to replace hormones. There are creams, there are gels, there are patches, there are injections, but the most efficient and the most effective method of delivery system is pellet insertion. Symptoms of low testosterone include low libido. You have patients with having erectile dysfunction for men. People have weight gain. Some people have fatigue. They have muscle loss. They also can have brain fog. And many people don't correlate brain fog with a hormone imbalance. Hair loss, that's also a possibility that it could be hormone imbalance. Night sweats, memory loss, many things like depression. Depression can sometimes be due to low testosterone, and people assume that it's due to just environmental factors such as the cortisol issues that we're having lately with stress and problems in the environment, such as COVID. But sleepless nights, these are all factors that sometimes are symptoms of low hormones, including testosterone. And most commonly, testosterone used to be thought of just for men, but women need testosterone. Testosterone is important to reduce osteoporosis. It's great for women to lose weight, actually. It's great for muscle mass in women. And also, I've had patients that have gone from osteoporosis to osteopenia by giving testosterone. And it also, by replacing testosterone, can prevent sarcopenia in men, which is also bone loss. So these are very important symptoms that people correlate to other things such as aging, where they may be actually just imbalanced. It also affects quality of life. People's feeling of well-being is really affected by low testosterone, low estrogen as well, and low progesterone, and replacing these are very essential. The method of pellet insertion is easy, it's comfortable, and it's a steady state that you get a slow release over time, and you don't have to worry about contaminating someone else, and you can actually have the benefit of no one even knowing that you're doing this, because you don't have to worry about contamination. You can swim, you can run, all the other things like creams and gels and patches, they all can sweat off during the summer months. But the pellet is underneath the skin, steady state, you're getting great quality without the side effects. We always have everything laid out in a sterile manner. As a surgeon, we want to be able to be very sterile and helps reduce risk of infections. So we have sterile gloves and everything, including pellets, betadine, and the field that's protected with the drape is all sterile. And we are going to have the lidocaine all wiped off with alcohol, and we're also going to have a sterile field at all times. So we put on the gloves, and then we're able to use the cleaning segment, which starts with the betadine. And we open the betadine and then use the betadine for cleaning the area. And whenever you do sterile technique, you start at the middle of wherever your incision is going to be, and you are able to go circumferentially around. The chlorhexidine is also starting from the middle with circular motion, so you don't bring the dirtiest area back into where your incision is going to be. And you do the other side, starting also in the middle and going circumferentially. Then the drape that is being utilized has a sticky component to it. And just so that you apply it in the proper area, it's best actually to open it all up and have your center be exactly in the center of where your incision is going to be. And my marking is here and the other two markings are there. So we're able to apply that sterilely in the field. We want to wipe off the lidocaine bottle before inserting the needle, which is also sterile, 18 gauge needle. And we're able to remove the lidocaine. And this is lidocaine with epi to help prevent bleeding. And then we're also going to use regular lidocaine so that we don't have so much epinephrine. And I'll get rid of the air and get additional lidocaine. And then I'm going to throw away the needle in our sharps container and get the needle that I'm going to make a wheel. So I use the smallest needle, which is a 27 gauge needle. For the skin. And the reason why this is better is because it's much smaller than the needle that I want to insert with. This is a 27 gauge and this is a 21 gauge. So this hurts a lot less when you're actually doing the insertion. Then we have my nurse who will actually spray this topical anesthetic, hazmat spray, so that it can ease the pain when the needle is placed. You spray until the area turns white, and when the area turns white is when we know that it is numb. Are you okay? So just then the 27 gauge is to create a wheel and a superficial wheel. And that helps to numb the skin. So now when I change the needle, 21 gauge needle, then we can have an area that's already numb, and we want to go deeper. And then we want to go at the angle of which the two tracks will be created. And I create a V form injection and another V. And this is lidocaine and lidocaine with epi. Little sting, okay. Bicarb, sometimes if we use, okay, if we use bicarb, that sometimes would also help. And so now I'm going to apply pressure to allow the lidocaine to absorb and disperse along the tissue planes. Why this this actually prevents creating a fluid collection that would create a tract for the pellet to come through. So when we massage the medicine in, it disperses the medicine and prevents it from creating a fluid tract, and then the pellets have a chance for extrusion. This should help to reduce that by having it circulate. Plus it helps with helping to stop the bleeding as well. And then the sharps go in the sharp container. Okay, so we have to get everything ready. I have a pickup and I place the pellet within, this is the anastrozole, so it's a lot smaller. And I place them within the funnel. And then we also apply this to the device for insertion. And we need a second, since we have, so sometimes it can go in easy, but the funnel makes it easier. But you can actually also do it without the funnel. And then you have these ready to go. Now this is the knife, and the knife is able to make the incision. We're also going to need a 4x4. So the knife actually, when I place it here and hold up the skin, we've gone through where the cane was actually placed, but I want to make the incision a little bigger for the trocar. And then apply pressure. The angle at which you place straight in, and then turn to the area of which we did our tract. So this has the medication within the sheath, and we're going to place it at an angle that goes towards and the depth is stopped by this usually, and then you know the depth at which to insert. And then the medication is released. So I apply pressure after insertion of the pellets to prevent any hematoma formation or any bleeding. Usually we recommend for patients to check for any bruising, any excessive bleeding, any extrusion, any infections. Those are the main complications, but we really have had none of those. He's done really well, and partly his sterile technique is a major factor in preventing infections, and also making sure that people stop their fish oils or aspirin or any blood thinners, including ibuprofen, a couple days in advance. And then also the technique and angle. The angle at which we try to do the insertion is important. So we use steri-strips. We don't actually have to use suture technique. And the steri-strips are placed to close the incision. And if there's any oozing, you can dab, but very little, because you want to make sure it's not bleeding. And the steri-strips are placed in a yes. And I usually make sure that I apply enough pressure that it's no bleeding. These steri-strips usually will stay on until they fall off, and this is usually up to a week. Then we put a 2x2 dressing that I folded into smaller to be able to allow pressure when we put the tegaderm on. So we take the drape off, and the Tegaderm is applied to seal. And when we seal that, after 24 hours, you can shower. So usually within 24 hours, we have them shower, take the dressing off, but the steri strips stay on until they fall off. One of the main things with doing the procedure is sterility, applying pressure to prevent bleeding. It's very important that the patient knows not to take aspirin, omega-3s, ibuprofen ahead of time to help reduce bleeding. We also use lidocaine with epinephrine, and that helps also. When things are completed and we're sure the patient is comfortable, we make sure that they know the post-procedures, which include no excessive activity for 48 hours. So no squats, no lifting, no running, no jumping for 48 hours after, and that they are not able to get the area wet for 24 hours. And we always call the next day to see how they're doing and making sure that they're not having any complications. Thank you for watching this video on pellet insertion. Any questions, we can be reached at 785-236-1693 or quantumhealthmhk.com.